My topic for discussion board 3 is sensitive subjects and risk assessment and diagnostic interviewing. For those who don't know or did not get my name in our first class session, my name is Gary. I chose this topic because I felt like this is a very sensitive area of, to discuss for the class, and it was a very important topic that came out of the chapter for me. I know that I foresee that sometimes I may, when I run across clients that come up with a sensitive topic, I want to be able to deal with it, because I don't want to be wrong. And as professionals, we need to be educated on these type of things, and we need to have all kinds of options available for us whenever we run across a sensitive topic. Now, according to the authors, there will be sometimes some important subjects that come up during intake and assessment. There will be some important subjects that come up and during these interviews, and so these subjects can be sensitive, and they could, but should not be, we should not overlook them or discard them. In other words, we should pay close attention whenever a client comes to us with a sensitive topic. But as a helper, we need to be careful in these situations. And if we feel that we're not capable to handle these situations, we need to seek the help when assessing them. In other words, we need to seek the help of our coworkers, our peers, or our supervisors whenever we come across a sensitive topic with our clients. If we don't feel that we're capable of dealing with it, that's what we need to do as helpers. And so that was why it was so important that I wanted to talk about this in the discussion board 3. Now, if a client brings these type of subjects up, we would be wrong if we did not help them. We can't, ignore them if they bring them up. We have to pursue them. Because this could be very well the reason why the client is seeking help in the first place. This may very well have something to do with why they're seeking our help. So when they bring them up, even though they're sensitive, and we may have our own personal feelings about them and so forth, we still need to pursue them. Now, the type of subjects that would be sensitive topics are suicidal thoughts and behaviors, homicidal ideas and violent behavior, substance use, including alcohol, street drugs, and prescribed medications, sexual issues, including sexual orientation, sexual practices, and sexual problems, and finally, physical, emotional, and sexual abuse, both historic and current. So when these are the sensitive topics that the authors discussed in the book, and that I feel will be sensitive topics that we will encounter as helpers with our clients in any given concentration that we have. So we need to keep this in mind. Now, the authors did recommend the interviewing strategy of plus and minus approach, which I found this very helpful as well. And basically, they said what this means is the clinician balances difficult questions with those that are less threatening, so that if a client reacts emotionally to a difficult question, the interviewer follows up with a question that is more benign. In other words, more gentle, with a gentle disposition or showing some kindness. So whenever we're faced with these sensitive topics, we need to show that we have compassion to the client, and that we really have some empathy, and that we're really concerned, and that we're going to help them through this, whatever it may be. We cannot disregard this. We cannot throw this to the side, because this very well mean the life of a client or someone else. So we need to keep this in mind when we're dealing with sensitive subjects. Now, as I was going through this, there was some ideas of questioning that was given to us in the book that we can keep in mind. That was presented in the book, some questioning that was presented in the book that we can use whenever we deal with these sensitive topics with our clients. And we have to learn how to follow up on these queries. Once we allow for them to answer the question, we need to follow up on those queries when they're presented. In other words, we need to follow up with them. We need to stay focused on what they're talking about, etc., and during the client uh, helper relationship. Now, I also went into some other thoughts about sensitive subjects and risk assessment and diagnostic interviewing, and I came up with some things myself that I thought would be helpful for us as well as myself when we're dealing with sensitive topics with our clients. And one thing we got to understand is we cannot delay the tough conversation. We cannot delay the tough conversation. If they come to us, even if this is not our first intake interview or this is not our first assessment, if, be ready for the topic to come up. And if it comes up in the first interview and in the first assessment, then we address it, you know. But if it comes up later on, we still can't delay addressing it. We have to address it, in other words. So we need to not worry about delaying these conversations. We need to, you know, get right on it. We need to discuss it with them right away because it's something that may be helpful in their treatment or their therapies, if you will, their therapy, if you will, while they're here seeing us in the first place. Now, one thing we cannot do, because they're sensitive topics, we cannot make it about us. We got to understand that it's about them, and the communication has to be on them. So we must focus our questions on them without bringing ourselves into it. Even though we've had probably have had experiences ourselves with some of these sensitive topics, we cannot bring ourselves into it because we're there as the helper, and we must remember that the communication is about them, not us. So that's one of the things that we need to keep in mind while we're talking to them about the sensitive subtopic that they have brought up. That they have brought up. Now, there's some tips to that I discovered doing researching this was of surviving difficult conversation because depending on the client, the age of the client, the sex of the client, these can be some difficult conversations, and we don't want to mislead the client with our empathy or in our sensitivity when we're discussing these things with the client. We have to keep our conversation with them civil. In other words, if they make us angry, with what they're saying, or any type of way, we must keep it civil. We must keep our mind focused. We do not need to rehearse. Say for instance, if we know ahead of time we're going to be discussing this sensitive topic with them, we do not need to rehearse what we're going to say and do during our conversation with them. We need to let the conversation flow. So there's no rehearsing, so that they can see that we're very empathetic and that we are sincere in our delivery of services to them. We must resist making assumptions. Must resist making assumptions. Just because we've had a client in the past that have came to us with the same subject, for instance, suicidal ideations, that don't mean that we have to have the same approach with this client. Or just because we of some other type of behaviors we picked up or some things that we've observed during the conversation with this client, that don't mean that we can't take it serious. And definitely if it's our first meeting with this client and they have suicidal ideations or homicidal ideations, we must then take that time to tell them, look, the laws and of confidentiality, that if we're bound by law to report if they're going to talking about doing some harm to someone or to themselves, we bound by law to protect them and others. And so we need to let them know that we need to address that situation right then and there, that it's going to have to be addressed. And if there's someone that they're threatening to kill, we need to notify that person, find out who that person is. We don't have to let them know. The client know what we're doing. But if they're talking about that, we need to get that information so we can notify the person, and we need to know notify the proper authorities. And once again, that's where we have to seek the advisement of our peers or our supervisor whenever we're faced with someone that comes in with homicidal thoughts towards someone else. If we're not sure about what we're getting from them, we need to seek some consultation with our supervisor. But if we already know the laws and the rules of the agency and whatnot, then we need to proceed accordingly. Okay, so once again, understanding that when it comes to suicidal ideations or homicidal thoughts, we're bound. Confidentiality goes out the window, so to speak, because we have to do what we have to do to protect that individual or others. Okay, now some of the mistakes that we make may be we fall into a combat mentality. We fall into a combat mentality. We begin to take it personal because we are allowing our own experiences or feelings to come in. We can't do that. If we're talking to someone that has their different ideas about sex, we can't bring ourselves into that. You know, we can't get combative. If they're talking about doing violence to us, the only thing we should think about is safety. We can't get into the combat mentality to feed into that, or to allow them to think that we're gonna uh, be combative with them. You know, they may be very well have just had a bad day, or they may very well just, you don't know the history. You know, unless you've spent some time with this client, you really don't know what their behaviors are like. You don't know how violent they can become, anything. So we have to be very careful and not to fall into a combat mentality with them. Okay, we don't. Another mistake that we sometimes make is we try to oversimplify the problem. We don't look at the problem seriously. We don't take the problem seriously. We think that the client is just talking. But hey, there's been many, many stories out there of bad things that have happened to clients and to others because of counselors not taking them serious. So we must let them know that we are listening to them. We're not oversimplifying the problem, that we're there for them. Okay? One of the things we have to do as well is we got to bring enough respect to the conversation. We have to have that respect even from the get-go with our clients. Even from our first meeting, we must gain that respect to where they'll respect what we feeling, and that and they can respect us enough to reveal the things that we need when it comes to sensitive topics to help them. So we have to build that respect. We got to make sure we bring respect to the conversation. We have to respect our clients, regardless of our own personal feelings of what they've done or what have happened to them or anything of that nature. We have to respect them as the client. Now, we can't lash out. You know, if they come in and they start using racial slurs, we can't bring ourselves into that, and we can't lash out at them because they're using racial slurs. We can, with sympathy and empathy, emphasize to them if we don't agree with that in a nice, polite way, but we're not to agitate them or lash out at them. Another thing we can't do is shut down. If they come in acting that way, we can't immediately say, okay, I'm not going to talk to you. It's time for you to go. No, we need to listen and hear that client out. Now, if we feel uncomfortable, I'm not saying stay in that situation if you're uncomfortable. You know, if you already got a feel of the client and you know they can become violent and aggressive, then you need to let your coworkers know, leave your door open when that client comes in, have an escape route planned before you come in. Position yourself in the office area or wherever you may be to where you can have a escape route if you feel threatened or if you feel that this client can become violent. You do no way put yourself in a situation, but at the same time, you must not shut down. You need to talk to this client at that time. And then if there's any other situation that arises out of that, if you feel threatened, you don't feel safe, that's something you need to take up with your supervisor. Okay, but we cannot shut down. We're the helpers. We can't take it personal. That's one thing I've learned since I've been in the human service field, is that you can't take things personal. And believe me, I've been in some situations where I know that there's a lot of people that can't deal with the things I have to deal with people. You know, I've worked with children that hit me, spit on me, and so you have to learn how to, if you're not in the helping field, to understand that those type of things may happen to you, then you're in the wrong field. So you need to understand to not take it personal. Okay, we cannot react to thwarting plays. In other words, we're going to have some clients that come in that are very cunning. We're going to have some clients come in that will we may not like for whatever reason, but we cannot allow them to those use their thwarting plays, react to their thwarting plays. In other words, we must keep ourselves focused on helping that client. Okay, and if they're playing games with you, you need to come up with some questions to get the focus back to why they're there, not focus on their game plan. In other words, let them know that they're the ones seeking help, and that's what you're there for, to help them. Now, sometimes we may get a little hooked. We can't get hooked. That's a mistake. We might get hooked with the client. If the client comes in and reveals to us some traumatic childhood experiences that may bring us back to our childhood, or that you feel very, very sympathetic towards, and we can get hooked in the situation of really trying to help them. One thing we got to do is we got to allow ourselves to help them, but at the same time, we can't get hooked into it. We can't get it hooked to whatever that sensitive topic may be. We need to deal with it. We're bound by different laws, confidentiality and so forth, but we need to deal with it. If someone come in there and tell you they want to kill somebody, we can't we can't allow them to get away with that, regardless how we feel about that individual. We gotta let them know that's wrong, and we're gonna have to do something about that. And we can't get hooked into it with them. In other words, okay. As I mentioned early on, one thing we don't want to do if we know we're going to be discussing a sensitive topic with our client is we do not want to rehearse. We do not want to rehearse because we don't know what's going to come out of that conversation with that client. So we want to go in that conversation with an open mind. There's no need for rehearsal. We need to keep our mind focused on what is the problem. That's basically it. Just keep our mind focused on what is the problem. Why is that client there to see us in the first place? And that's why we're there to help them with that problem. What would the client see the problem to be? What would the client see what the problem is? We need to focus on how the client is looking at the problem, whatever that may be, and whatever the sensitive topic is. That's what our focus needs to be on. And what would be our preferred outcome? We need to think about that as we talk to the client. What would be our preferred outcome in that sensitive situation that he has brought to our attention, he or she has brought to our attention? What would we like to see the outcome to be? What is my preferred relationship with the client? That's very important. What type of relationship do you want to have with your client? Are you there sincerely wanting to help this client? You know, then we have to understand that that's what we're there for. We can't, uh, just make up a relationship with this client. We have to have a preferred relationship with this client and keep it professional. And these are some of the things that we need to do in order to keep us from trying to rehearse before we deal with these sensitive topics. Once again, I brought up we make us assumptions about our clients' intentions. We make assumptions. Oh, he ain't gonna do nothing. No, we need to really understand that there's a possibility that some of these things that they're saying they're gonna do, they may do. If someone say they're gonna kill themselves, then we need to find out if they have a plan, if they have any weapons in their home, what type of drugs they're using, etc. We need to know exactly what's on their mind. If someone is talking about killing someone, we need to find out why they feeling this way, why they feel like they need to react that way, why they want to be violent. We need to go into the questioning of those type of questions to find out if there's any kind of way that we can change their mind on that. We can't assume that they're just talking. Can never do that. Assume. A lot of clinicians have done this in the past, and because of that, a lot of people have died from suicide or homicide. So if they telling you, hey, I'm doing this and doing that, you come in and you need to understand and assume. If you break it down, some of you know what that means. You know what I'm talking about, and that we don't want that to happen to him or us. So we need to not assume what our clients are going to do or thinking. Okay, now there'll be times that we have children that we talk to. We still cannot assume that they're just talking, even though they're a child, 12, 13 years old. They talking about doing some harm to someone, or they talking about doing some harm to themselves. We must take that seriously. And that's one thing about when it comes to sensitive topics, we need to remain focused. We can't lose sight of the goal. In other words, we can't lose sight of the goal. We have to keep our mind on what our goal has been set for this client. And we can't, even though this client is throwing in a sensitive topic, we still need to keep it in line with the goals that we have set for this client. In other words, we can't lose sight of that. We have to keep our content clear when we're talking to the client. We have to keep our tone neutral. We can't let them feel like we're going against them or we're going for them. We must keep our tone neutral during these conversations. And we keep our phrasing temperate. We keep our phrasing temperate. We must just remain temporal with them, temperate, and we must let them realize that hey, we we're here. We're here for you. Let's talk about this. Let's see if we can change your mind on whatever it may be. If it's something homicidal, suicidal, or if it's some issues that you're dealing with sexually, or if you're having a problem with drugs, if you're not there for drugs already, let's talk about these things. Let's discuss these things and hopefully come to some kind of way to help you do this. Now, some question ideas was also presented in the book. And those can be found on page 211 of chapter 6 and 212. And those are some good question ideas to use whenever somebody is talking about doing harm to others or doing harm to themselves. And I suggest that you all, you know, try to read over those and keep those in mind as you go forward uh, in this class and further on in your careers. Because one thing I've found so far in the book, these are some questions that I'm going to keep in mind and refer back to whenever I have a situation where I have a client. Uh, Once again, if I'm going to try to embed some of these questions in my heart so that I'll know how to react as we go forward. Then again, you can't rehearse. You have to leave the questioning up to the situation. And I thought that was very helpful that they had these in the book because see, one thing that the questioning will do once they answer the question is to give you a chance to follow up with some queries that can be presented at that time. Queries into that situation, and to help you be ready to deal with that sensitive topic professionally. And it could save that client's life or someone else's life, or it could, depending on the topic that they're bringing up, could give them a clear understanding of who they are as a person and why they feel the way they feel. So on that note, I would like to end that I found this part of the chapters I read, this part stuck out to me because I know that I may face some sensitive topics with clients and with my own personal feelings and whatnot. This will help me not to learn to learn how not to bring those into this interview and to proceed accordingly in a professional manner. Thank you. I'm looking forward to some of you all's replies.